everyone, this is Anna Maria from Taylor Physiotherapy. I'm here because I am just recording a video about how you do your pelvic rocks, which sometimes we give as an exercise in the clinic to help reduce any stiffness in and around your lower back and your sacroiliac joint, which is the lower part of your spine, and also to help you a little bit. I get a bit of clients in Pilates sometimes, even when they've been doing Pilates for a very long time, or even if they're new to Pilates, not knowing exactly where, or just looking at us with a really complex and confused face when we say, okay, so now find your center. So we tend to explain it quite well, but sometimes it needs a little bit of time for your brain to actually get more comfortable into where you are in space, especially with pain, and for chronic pain in the back and for injuries in the back. Sometimes this takes a bit of time, and so it takes a little bit of practice. So what I wanted to do is just go through the pelvic tilts movement, which are very useful as an exercise on their own, and also go through how I tend to find my patients understand it a little bit better when I teach it in the class. So what I would suggest is you will find something or somewhere, either on a carpet or a mat, try and have no socks, because that will help you even just to feel where you are when you're lying down. And if you need to, you either have a small pillow or a folded towel. Sometimes a folded towel is better because you can adjust it to however you want its thickness, really, and it's all a matter, which I'll explain when you lie down. And before we do or explain anything, most of the time we always talk about centering, and it's essentially the ideal position of where your spine and your lower back should be. So it's part of centering, so it's not just your lower back, the centering. The centering will involve your body in being aligned in an optimal position to work well and take on the load equally through both sides of your body and even to the center of your spine. So most of the time, if we have a very arched spine, so your lower back will be very arched forward, what we tend to have is the muscles in and around the back would be very close packed because they're contracting all the time, and the muscles in and around the front, they're very, very extended, so they're not exactly working at their optimum. So they're trying, even if you're trying to contract and you're keeping your back extended, you're trying to do an abdominal crunch, or you're doing your core exercises and you're not doing them well. Equally, if you're on the other side, so if you're hunched all the time, your extended muscles, so your lengthened muscles, are towards the back, and your very tight muscles are towards the front. So equally, they're not in the most efficient position. So we tend to use the mid position in Pilates, which is in the center. Now, obviously, centering and pelvic tilts and finding the midpoint is different in different positions. So essentially, even during class, we also say, okay, so now we're doing it in standing, we're doing it in lying, we're doing it in 4-point, we're doing it in side lying. So each position demands different cues and demands different almost an awareness, which you can't just do. Well, you can't just say we're gonna do the exercise on the floor and fine, I've done them and I can feel the benefit of them. It's not going to translate immediately into everything in the position, so that's why we explain it every single time. So I'm just going to take the simplest of them, which is when you're lying onto the floor, and the reason for that is because you have less body weight going through your spine, and you're less needing to control a lot of other elements. So it's just lying on the floor, and your body, you don't need to control your body weight, basically. So my suggestion is lie onto the mat and just make sure your feet are barefoot, so you can equally find you get a bit more sensation through your feet. And then just position your head onto your head pillow or cushion. Just make sure your head is not too high up where you're pulling your neck, because if you have any issues with your back, that's going to make it flat and pull, or even so if your head is too far backwards. So it's almost just a little bit, very tiny bit. And the good thing that you get from a towel is that if you want it thicker, you fold it more. If you want it less, you fold it less. So that's a good thing why having a head pillow a towel is better. If you have a ponytail, just remove it. That's why my hair is in a braid, because it's easier and your head remains in a good position. Your feet, bring your heels a bit closer to the bottom. Your knees should be in line with your hips and your toes pointed forward. So the easiest way to start off with is if you close your feet together and then you turn your toes out and heels out. They should become in line, and your knees shouldn't be knocked together or opened out. They should be parallel, so they're in line with your hips. Just make sure that you're in the longitudinal line plane of your mat and you're not in a diagonal. So you get a lot of patients that would be not aware of where their body is, so this is a good way to start off with. And then just make sure that your shoulders, ribs, hips, knees and toes are in two parallel lines, and that your head and your spine just falls in the middle. Then a good way of starting off with is, first of all, just feel where your body is. So you should have a pressure underneath your heels. You should have most of the pressure also underneath your tailbone and the top of your head into your upper back, and maybe a little bit empty through your lower back. But we're going to just be aware of where you are, basically. So soften those shoulders down, and to get to do your pelvic tilts first, and that's what's going to get us then to find your centering. I tend to use this analogy of using a diamond shape. So basically a diamond shape is putting your index fingers together and then your thumbs together and your index fingers together. So you form that kind of a diamond. And then your palms of your hands, which is this part over here, will go onto your hip bones, which is the big pony bits that you feel jutting out here of your pelvis. So you put your thumbs together and then your index finger together and then your palms onto your hip bones. Even if your index finger and your thumbs don't essentially touch, just make sure that they form essentially a diamond. So I have to sit up and you make a diamond onto your pelvis, your hands on the hip bones, and they're creating almost like a diamond shape. So if you stay there, so your hands are onto your pelvis, what you want to start doing is you want to tilt the weight from your tailbone towards your pubic bone. So that creates a big arch into your lower back. And then you're going to tilt it away. So that creates a flattening of the lower back. So then we go forward, you point towards your pubic bone, and then you go back, you point towards your tailbone. You go forwards, and you go back. So this is essentially your pelvic tilt. And your pelvic tilt takes you through the range of your lower back. You're really trying to focus on this part of your body, which is your pelvis, and you're trying not to move too much through your chest. And you're really focusing on pushing forwards and pushing backwards. So there is no lifting through the bottom, there is no pushing forwards with the chest, no exaggerated movements, just a simple roll forwards and backwards. And what happens is if you do it very early morning or after a day of sitting down, going forwards and backwards will be a little bit stiff. So you want to just go slowly when you do it and just feel the movement going forwards and then going backwards. And again, with your hands, just the guidance. So after you do a few of those, to find centering in your lower back, it's basically the halfway point. So when you arch forward and your index finger are pointing down, you have a big gap in your lower back. So you don't want that. Then if you press all the way back and your index finger is pointing up, then you have a complete no gap. So you want somewhere in between, where if you imagine your diamond, it's just lying flat. It's not pointing up, it's not pointing down, it's in the middle. So what that creates is if you grab your hand and you just slide it into that gap, it should feel nice and snuggly. So it's not squeezed down all the way. When you're flattening too much, that's what you feel. And it's not too empty. It is just nice and snuggly. And that gives you that tiny bit of a curve that is natural into our spine. And that creates the best anatomical position for your muscles to work most efficiently. So then after that, what you would want to do in every single exercise that we do in Pilates is to maintain that position. And that's how you build your strength. So when you're in class and you feel like you're doing something that's making that arch either too big or too flat, then it might mean that you need to take it down a level. So you really want to just aim into that centering. Obviously, then you've got your rib cage placement and your breathing, but we're not going to talk about that today. We mostly wanted to focus on your pelvic tilts. So again, diamond shape position, lying onto your back, and if you use your diamond shape, it helps you going forward and backwards. Obviously, everyone has different cues of doing your pelvic tilts, but yes, just find the one that you feel the most comfortable performing. And the idea is always to be a little bit more aware of what you're doing, because essentially, either having pain or even not having pain, your body would have been used to a posture position for a very long time. So for you to get out of that position, it takes a bit of time and it takes a bit of practice. So if your practice is at home, it will also just gives you a little bit of a boost to be able to then build up onto your strength into the classes. So I do things like this and even more things into my classes. So if you're ever interested in joining my classes, just find just email us at reception@taylorphysiotherapy.com and we'll let you know when the classes are. They're currently virtual, but hopefully we'll be able to give them to you physically after all this is over. If you have any questions, please let us know. I'm hoping to do another video about rib cage placement and lateral breathing, which also helps. And yeah, just give it a go. Thank you.